Hi, everyone, and welcome to another edition of the Lympha Press Educational Webinar Series. We know you're logging on right now, and I'm going to do a proper introduction of our guest, but this webinar emanated from a conversation that started at Lympha Press's monthly Research Roundtable. Research Roundtable is intended to be a free-flowing conversation where we open up cans of worms and talk about things with people who have a lot of questions and some answers, and we grapple with all of it. Dr. Philip Houck was with us for a Research Roundtable, and we had such an amazing response to his participation. We decided to have him back to do an actual presentation for us, which is why you've all logged on tonight and you're here with us. The topic is lymphatics, future perspectives, unrealized potential. And I will tell you that Dr. Houck is a cardiologist in Temple, Texas, is affiliated with multiple hospitals in the area, including Baylor Scott White Medical Center, Taylor, and Baylor Scott White Medical Center, Temple. He received his medical degree from McGaw Medical Center of Northwestern University and has been in practice for more than 20 years. What are you going to hear about today? Well, he's going to review the role of lymphatics in salt sensitivity, cardio-renal syndrome, sodium-dependent glucose transporter, and brain disease. We're also interested in these topics. We want to thank those of you who have logged on. By the way, please let us know you are here in chat. We are recording this webinar. In fact, let me put our regular disclaimer in here. We are recording this. Everybody who registers will receive a copy to the replay. We see Kathleen listens here from San Diego, and other people are logging on to say hello. Please do chat, put your questions in the Q&A. We will address them at the end, and I am going to yield the floor to Dr. Houck. We're so glad you're with us tonight.
Well, thank you. You're a little bit in error on my years of practice.
Okay, tell me.
Yeah, I retired out of the Air Force, and I've been here as a cardiologist for 30 years. So it's closer to 50 years of practice.
Wow. Well, we'll have what you're having.
So maybe some of the people will want to sign off now because they figure I might not make it through to the end.
Oh, you are too funny. I will disappear now and take it away, Dr. Houck.
Well, thank you. And I appreciate this opportunity. I think that lymphatics certainly have a future perspective and definitely an unrealized potential, which I hope will get elucidated in the future. And every speaker needs to give disclosures, and I do not have any financial disclosures, but I think you should know the guy that you're talking to. And so no financial disclosures, but I don't like nephrologists. And that's because heart disease depends on the function of the kidney. And it seems like nephrologists are the only ones who know what hyponatremia is and how to treat it. I don't like rheumatologists because they could rule the world. They have all the knowledge of inflammation, and yet they don't apply it to diseases outside of ones that they particularly are interested in. I don't like endocrinologists because they're not there with the low birth weight baby who's going to have metabolic syndrome. They're not there in the middle of the night with a 40-year-old gentleman having a myocardial infarction and the cardiologist diagnosed diabetes. But I am at least equal. I don't like cardiologists. So you could say that I'm just plain grumpy, and that's the way it is. So what are we going to talk about? This is kind of the central theme, and we're going to break it up into several sections. Lymphatics are very important in, of course, protecting us, but they're also important in repair of our bodies. When a cell decides to give it up, another cell has to replace it, and the lymphatics does that. And you have to keep in balance this regenerative and degeneration. If it gets out of whack, you could potentially have cancer. If you age and you lose your progenitor cells, well, you're going to just deteriorate. And one of the mediators of that is the inflammatory system. And that's where the rheumatologist could rule the roost. Lymphatics are also protector from entropy. And I'm going to talk a little bit more about entropy from a science standpoint. But entropy is essentially disorder. And if your organ is disordered, it is not going to function. And we're going to apply that to the heart, cardio-renal syndrome, salt sensitivity, and brain diseases. So 480 million years ago, there was only insects around. Humans didn't appear to 200 to 300,000 years ago. And humans and these insects have something in common. And what they have in common is an open circulatory system. And an open circulatory system was necessary if you had multiple cells that have to maintain homeostasis and work in a cooperative manner. So the open lymphatic system, which we have in our bodies, is likely a derivative from these insects. So we all know that lymphatics are important. They're environmental gatekeeper of the heart. They transport fluid throughout the body. They help compensate for heart failure. And they also contain myocardial cells in that lymphangion, which is shown up in this corner here. That's the pumping chamber, which helps pump the lymph throughout the system. So when lymphatics are stressed, this troponin can leak out into the body, and cardiologists interpret that as a non-ST segment elevation infarct, when it's really doesn't have anything to do with the heart. It has to do with the stress of the lymphangion. So here's the introductory, the main meat of the talk, and the conclusions, all in this one picture. And so this is the garbage strike in New York City. And this is one of the major functions of the lymphatic system. It's got to take out the garbage. And if the garbage isn't taken out, the organs are not going to work well. So the lymphangion, again, is that pumping nature, and it has both an amplitude and a frequency. So it has a stroke volume depending on how dilated it is and the contractile force of the lymphangion. So I wasn't always a physician. I started out in engineering, and it frankly took me 35 to 40 years to understand medicine. I think I have a pretty good grasp of it now, but what bothered me was that there were no fundamental principles in biology. You can't build upon fundamental principles in order to determine a new disease process. And so I not invented, but have observed 6 fundamental rules. The first is biology has to be consistent with physics and chemistry. And physics and chemistry is not all worked out yet. There's still new things to learn. I've highlighted number 2, life as opposed to non-living exhibits negative entropy. And again, entropy is disorder, and we develop order out of chaos. That separates us from inanimate objects. And the energy to support this is yet to be defined. And this is one of the roles of the lymphatic function, is supplying entropy, a negative entropy, in order to maintain order. The cell is a fundamental unit of biology, of course, and it's amazing that all the information within that cell is there to build a whole nother individual. But negative entropy, and this is Erwin Schrödinger, and this is the equation that he wrote. And of course, in physics, there is no such thing as negative energy. So the equation is actually entropy is equal to K log of D. Now what D is, it represents disorder. And we'll try to explain to you what disorder is. But if you take the negative sign of entropy, it's then K log 1 over disorder. But Schrödinger predicted that there would be a molecule that would transmit information from generation to generation. This is well before DNA was ever invented. And he stated, how would we express in terms of statistical theory the marvelous faculty of a living organism by which it delays the decay and the thermodynamic equilibrium death? We said before, it feeds upon negative entropy, attracting, as it were, a stream of negative entropy upon itself. So let's try to explain entropy. Anybody recognize this? It's a Barbie's house. But before it looks like this, it looks like this. So the sum of the parts and all the different ways that the parts can be put together is considered disorder. So if we look at human beings, we have 50 trillion cells, 300 different cell types. The number of different ways they can be put together is disorder. But you can also look at the chromosomes and you can make certain assumptions. If you look at men and women, the number of chromosomes are different. Women have 45, men have 46. So men are more disordered than women, and we reach room temperature quicker than women. So that's why men live shorter than women. So entropy is a strong force of nature, and the lymphatics help to decrease entropy. The fourth law is the cell must be in homeostasis with its environment. And again, that's another function of the lymphatics. If you're making metabolic debris and you got to get it out of the cell, you got to take it to the liver where it can be processed. The lymphatics do that. Now, homeostasis also can explain evolution. So if the environment changes, so does the cells. And has the environment changed humans in my lifetime? And it certainly has. We have electricity, we're sitting more, we're eating carbohydrates, and we have evolved into diabetes mellitus type 2. Law 4 has predicted insulin resistance and diabetes. Now, Law 5 is predominantly a lymphatic function. There must be a distinction between self and environment. Immunity and inflammation are the defenses against invaders from the environment and responsible for repair and damage in senile cells. That's the job of the lymphatic system, the immune system, and it is critical for us to protect us, but also to give us repaired. And then the sixth is electromagnetic information transfer is necessary for development and regeneration. Well, if you are denervated because your spine is injured, the lower part of your body atrophies. And so we can use this information, and perhaps electrical stimulation of the lymphatics can improve the lymphangion and help alleviate disease. So all six of these fundamental principles are used in day-to-day life in determining disease processes and potential therapies. So we got to put this together into some kind of model. And so this model is a teeter-totter. And we see at the top, we have regenerative forces, and that's represented by circulating stem cells. So if you don't circulate your stem cells, you're not going to repair blood vessels. And what happens when you age? You have decreased circulating stem cells. If you sit, you decrease your stem cells. And if you have any of the risk factors for cardiovascular disease, your stem cells are reduced. But you have to have it modified, and the modifier is inflammation, lymphatic function. Why is that necessary? Well, if you have too many progenitor cells of the wrong type, you're going to get a cancer. And so you have to have an inflammatory response to get those cells back into the normal condition. And in turn, if you have decreased inflammation, that can help support your generators. So if we look at what attributes health, what are health activities, exercise increases circulating stem cells, and it also decreases inflammation. If we look at statins, it does the same thing. And so all of these things are important for maintaining our health and disease processes. But the key is lymphatic function. And the measure of lymphatic function is one of the measures is C-reactive protein, which seems to be central in determining where this fulcrum goes. If you have increased inflammation, the CRP level is going to go up. If it's decreased, the CRP level goes down. So can we use this to realize potential directed to therapy? What do we know? Well, we know that lymphatics in the lung are key in pulmonary edema. If your lymphatic function can be enhanced, your pulmonary edema will be resolved. We know that in the heart, if you have an injury, myocardial infarction, you get edema, and that part of the heart doesn't work until the edema is resolved. Takotsubo cardiomyopathy, stress-related cardiomyopathy, is likely a overwhelmed lymphatics that quit working, and so the myocardium swells, and then after a few days, they start working again, and the myocardium is restored. The kidney lymphatics, frankly have never been considered to a great deal, but consider if your lymphatics are not working, you're not picking up protein to get back into the systemic system. Instead, you're going to lose that into the urine. And if you have kidney swelling, that could have catastrophic effects on how you process plasma and urine. The intestines. Well, when we crawled out of the ocean, we had to give up salt and water conservation. And so our gastrointestinal system is part of that. And being able to store sodium, I think, is crucial in the gut lymphatics, and as we're going to see later. And of course, it's very obvious when the lymphatics don't work in the extremities, and we see edema and lymph formation, and this has considerable disease processes. But what we've never really considered is lymphatic function of the brain. It wasn't until really several years ago that neuroscientists even believed that there was lymphatics within the brain. Clinicians knew there was lymphatics in the brain because if someone had a concussion or they had brain edema, you could make it go away. And the only way you could make it go away is if you could remove that extracellular fluid and interstitial fluid. So we haven't considered brain lymphatics as a possible therapeutic tool. So the next couple of tables are ones that I looked at various papers to try to see what substances increase the lymphangion's amplitude and frequency, essentially the output of those devices, and the tone of the vessel. And there's different animal models, and you can look at the thoracic duct or you can look at the lymphangion. I like the lymphangion because I like pumps. And if you look at nitric oxide down here, it's a dilator, and so it depresses lymphatic function. If we look at the cholesterol, LDL, of course, it gets into the gut, and the gut, it increases the amplitude and frequency. It decreases the tone, so those vessels dilate. If we look at aging, the lymphatic function decreases. And this was looked at young and old rat mesenteries. And so if you're old, are you more likely to have heart failure? Yes. And why? Because your lymphatic function decreased just because the lymphatic function is getting older. If we look at the gut hormones, they increase lymphatic function, as you might expect. And so if you increase lymphatic function, maybe you might have better results in heart failure, which could explain our glucose 2 transporters that we'll mention briefly. Electrical stimulation increases it. And then if we look at ANP and BNP, medications actually that we can use to compensate for heart failure, the BNP is made by the heart when stresses in the heart are increased, and it increases the amplitude and the frequency to help compensate. So the open circulation system is compensating for the failure of the closed circulating system. It's called brain natriuretic peptide because it's found in sheep. But I'm beginning to wonder if these same substances might be good for brain diseases. And then there's a great lack in our knowledge. We look at all these different heart failure medicines, and I couldn't find that anyone looked at the effects of these medicines on the lymphangion function. My suspicion is that spironolactone ACE inhibitors definitely increase. I think that high dose furosemide decreases, as we're going to see. Then if we look at the medicines that we use for heart failure, if we look at sympathomimetics, epinephrine, dopamine, norepinephrine, they increase lymphatic function. So if we can increase lymphatic function, we can help patients compensate. And now we have 5-hydroxy serotonin, and it increases lymphatic function. And why am I interested about this? This is the neurotransmitter that people keep trying to give people drugs to take care of brain diseases. So I'm thinking that maybe there is no neurotransmitter problem. Maybe the serotonin increased by those medications simply takes more garbage out of the brain so that people can think better. So in summary, if we look at lymphangiotropy, and I made up this word, what this means is things that increase and decrease the function of the lymphangion. Naziretide, which is BNP, spironolactone, lymphedema pumps, mechanical stimulation, exercise, sympathomimetics, phosphodiesterase inhibitors, all increase the intervention. Calcium channel blockers, which make your legs swell, decrease it. Actose, the glitazones, decrease it. High dose loop diuretics. This is what I think causes cardio-renal syndrome because it decreases lymphatic function. And of course, when you come in sick and you have endotoxins and cytokines circulating, you wind up having decreased lymphatic function. So what are some unexplained diseases? Salt sensitivity and hypertension. This is a tough one. Cardio-renal syndrome. And many times we should call it renal cardio because the renal system causes volume overload and heart failure. And a blind squirrel finds a nut. This is our newest tier of heart failure therapy, sodium-dependent glucose transporter. And this is found serendipitously. And then finally, what I'm least able to talk about is mental illness, depression, schizophrenia, and intellectual reduction and Downs. And I want you to think till we get there, what do all these things have in common? So it's obvious to see that the drainage of the heart and lymphatics that we've got demonstrated here, lymph nodes, and I just threw in this slide. I'm not sure why it's there really, but excess of volume, eat less salt. That's what the DASH diet has taught us. And so why does salt give us trouble? Well, in our bodies, we have to have a certain sodium level, and that's sodium divided by water. So if you dump more sodium into the system, you have to fill up with more water. If you put more water in the pipes, the pressure goes up, and eventually you can have a disaster. But if we look at sprint adverse effects, and this was the most recent trial that said normal blood pressure is 120/80, and we need to treat medically if it gets to 130/80. We can lose lifestyle to that. And so what was the therapy that people often got was a diuretic hydrochlorothiazide. So the adverse events were hypotension, the number needed to harm was 100, syncope, number needed to harm 166, and hyponatremia, 58, number needed to harm. So why? Salt sensitivity. What is salt sensitivity? How do we diagnose it? Why are nephrologists the only ones who understand hyponatremia? How many compartments are there for sodium? Well, when I was first training, we had intracellular and extracellular, and we calculated volumes and sodium requirement based on those two volumes, intracellular and extracellular. But that is wrong because there are actually 3 compartments for sodium. So how do we measure? Should we select a diuretic as the first choice in everyone? Well, no, because if they're not salt sensitive, they're going to be harmed. Can blood pressure rise with diuretics? Well, if they're not salt sensitive and you give them a diuretic and dehydrate them, renin-angiotensin will raise the blood pressure. Do diuretics lower blood potassium, cause orthostasis, syncope, renal dysfunction, and all the adverse effects in sprint? Yes, it does. So salt sensitivity. So what this is you can get, when you take in salt, there are certain proteins that are in the endothelium, and the lymphatics are all composed of endothelium. And in the gut, where you first get your salt and water intake, the sodium starts going through to the system. And so if you have excess sodium, it can be taken into a protein so that it's not really in the intravascular or the extravascular space. And if you have endothelial dysfunction, because your endothelium is not taking it up, you're going to be more prone to having a salt-related hypertension. So the ability to store sodium in third place explains salt sensitivity. What we've not learned is how can we move that sodium in that third place in and out of the system. But lymphatics could be a target for treatment of hypertension. Since the gut lymphatics are the first to process environmental salt, and the lymphatics are covered. So cardio-renal syndrome. Cardio-renal syndrome occurs in people with heart failure, and they come into the emergency room and they're short of breath, their volume overloaded, and their creatinines are basically normal. And then they give a dose of diuretic and they don't pee and the creatinine starts to climb. So this is felt that they have cardio-renal syndrome, which no one quite understands what it is. And they stop the diuretic, put people on dobutamine, dopamine, and after several days, the kidney function starts recovering, and then they can reintroduce the diuretics and the kidney flows urine well. So why is that? So the biggest contributor to cardio-renal system predictor is high central venous pressure. And you can understand why that would be adverse to the lymphatics, because they drain through the thoracic duct into the central venous pressure. So if there's more pressure, it's harder for the lymphangions to move that lymph. If you have impaired renal function due to capsular restraint, why would you get that? Because the fluid is leaked out into the kidney tissue. The lymphatics aren't working because they're inhibited because of Lasix, and the whole kidney swells. So now you have essentially what we call kidney tamponade. The kidney is under pressure, and the only way to relieve that is to wait for the kidney to become decompressed. And so this is the cause of cardio-renal syndrome. Dysregulation of renal lymphatics lead to swelling of the kidney and compression, and you have to give medicines that enhance lymphatic function to help decongest the kidney. So in congestive heart failure, you want to decongest the kidney first. So blind squirrel finds a nut. So this is relative to the glucose, sodium-dependent glucose co-transporters. So this was found serendipitously because all new diabetic medicines had to be studied by the FDA for cardiovascular harm, because some diabetic medicines in the past caused cardiovascular harm. And when they did the study, what they found was there was not harm, but there was significant benefit and much less heart failure. Enough so that multiple studies were involved in diabetics, and eventually in non-diabetics, people who didn't even have elevated glucoses were found to have a tremendous benefit in the reduction of heart failure, and also a reduction in proteinuria. So, and the kidney function was preserved. So these are remarkable medications that really everyone should found. And not only are these transporters found in the kidney, they're also found in the intestinal mucosa of the small intestine. So it's a small leap of faith to understand the way that this works, because it doesn't have anything to do with glucose, is that if it improves lymphatic function, it will help decongest the kidney. If it improves the lymphatic function, it will decrease the amount of proteinuria that's lost into the kidney. So now we're getting down close to the end. And my question to you early on was, what did all these disease processes, delirium, and I've been in the hospital and patients come in and they can be as goofy as can be with their infections, run down the hall naked, confused, be the meanest type of people that you can imagine. And then you follow them up in the clinic and they're perfectly fine. Well, what happened to them? What caused that ICU delirium? Why was inflammation and illness associated with bad brain diseases? And so if we look at delirium and C-reactive protein, age and aging, if we look at C-reactive protein and schizophrenia, if we look at inflammatory biomarkers and intellectual disability in Down's kids, it's all elevated. And in fact, in Down's kids, the higher the CRP, the more mental disability that the individual has. So how can all of this stuff be related to the brain and lymphatics? Well, C-reactive protein is, I think, the kind of the key, right? We showed that that was part of the fulcrum of directing inflammation in the brain forward and backwards. And it's a pentamer. And if you look at CRP, it increases lymphangion function. Oh, well, that's a little bit confusing. But if you look at CRP, it has both a native, which is this pentamer, and then it also breaks down to monomer. And CRP does both things. And when it initially, on acute infections, where you want the lymphatic function to be decreased so that the infection is contained, and then later on, you have the monomer, which is going to do exactly the opposite. So C-reactive protein is a complicated kingpin. And in these brain diseases, if we can modify C-reactive protein, or if we can increase lymphatic function, perhaps that should be the target rather than neurotransmitters in all those diseases that were listed. So I think we'll call halt there and give a couple of summary slides, and then open it up to questions. I doubt that I'll have very many answers, but I hope that you have questions from what I've said. So can the study of lymphatics solve puzzles presented? Well, I think so. Inflammation and lymphatics role in biology is a fundamental principle. And so we need to study it. Lymphatic function explains the symptoms of heart failure. Why not explain diseases in other organ systems? Lymphatic function cannot be separated from the immune system. We need a map of the lymphatic system and a map of the immune system. All medications in clinical trials, I think, should be sent through rat mesenteries to see if they have lymphangiotropy. And then maybe we don't have to rely on a blind squirrel finding a nut. Maybe we can actually look for those nuts that are hanging up in the tree. We need new imaging modalities. See if we can see salt within the skin to be able to determine whether a patient should have a diuretic or not. And I'm quite sure that somewhere in our genome, we can find the exact same DNA of the open lymphatic system of insects, and that we just borrowed it from the insects to help us come along. And if we could determine that, maybe we could rebuild the lymphatics. And certainly trials of mental disease stimulating the lymphatic system. And if we look at mental diseases, what things help? Exercise helps. What does exercise do to lymphatic function? It improves it. So I think it's a small leap to say that we should investigate new structural problems in the brain that involve the function of the lymphatics. And I still would like someone to show that high dose diuretics should be studied for negative lymphangiotropy, explaining cardio-renal syndrome. BNP needs to be resurrected. Natracor went away. And I see so many other uses for this medication in ARDS, cardio-renal syndrome. And we used it in patients who we were worried about cardio-renal syndrome. We would start Natracor and run it for at least 30 minutes to an hour before we would give diuretic therapy. And we didn't get cardio-renal syndrome in those patients. Maybe Natracor should be given to patients who have a mental disease. It all fits within the theory that if you improve lymphatic function, you take out the garbage better and you make the patient better. It's all negative entropy. So thank you. Go to work, solve problems from a different perspective.
So you were right. You said that you had a lot of questions that you would be raising. And I think that a lot of us in the audience, and myself included, are sort of stewing on some of the concepts you said. Let me go to one of the questions from the audience. Laurie Caves, we're so glad you're with us. She asks, this is great, but how do you get doctors to even learn any of this, as they have no idea most often what it is in lymphatic dysfunction? So how can we get help as patients? It's that still understanding the role of the lymphatics and the need for more advanced learning in the medical profession. One of the reasons why we do webinars like this, but how would you answer that to a patient like Laurie Caves, Dr. Houck?
Well, it's frustrating, really. You know, I've been writing about this for some time. I don't know if anybody's read what I've written. So I work here at Texas A&M, and we have a group of basic scientists that all they do is lymphatic function, and they are doing tremendous work. And this is really where my eyes got opened up when I saw a lymphangion, and then they presented their work on how old Rax lymphangions didn't work, and they showed the video pictures of it. It is, you know, it's hard to change people's perspective. You like to know what you know, and anything that's new is uncomfortable. So I just hope, I'm trying to write another paper with essentially presenting this work today that hopefully other people will look at, criticize, but maybe they'll get an idea. And I would like to see, you know, psychiatry really take a different tact and start measuring biomarkers for mental disease. So like I said, I'm not going to have good answers, but I'm glad that we've raised more questions.
Well,
that's how you get to the answer.
That's how you get to the answers, because you provoke brilliant people, and we have so many brilliant people that have logged on tonight, and many that are going to watch the replay, and this will provoke thought. So you have coined this term, lymphangiotropy.
Yeah.
So can we say this is the webinar where this term was introduced to the world? And can you give us the definition one more time?
So lymphangiotropy is substances that improve the amplitude and frequency of the lymphangion. So they increase its function, its pumping ability.
I think one of the big takeaways for me, and again, audience, while we have Dr. Houck, please feel free to put your questions in the Q&A, is the connectedness, how the lymphatics affect every area of the body and the mind. And it is Mental Health Awareness Month. This May is Mental Health Awareness Month. And we know that we have a mental health crisis in the United States, and we need answers. people are looking for answers, and out of the box answers perhaps are where we need to be looking?
Well, one of the answers for mental health is we need to emphasize more sleep hygiene, because that's when the lymphatics go into job. That's when they do their garbage collecting. That's why we have to have sleep. And so having 7.5 to 8 hours at night is critical for lymphatic function in order to clean that garbage out of the brain. And overnight, your brain does make adenosine, and that kind of gives you that foggy head feeling. And your morning caffeine kind of wipes out the adenosine, and that's why you drink coffee. So lifestyle certainly can improve lymphatic function. Exercise certainly can. Sleep is an important aspect of everyone's health. And then the third is nutrition, because everything that goes through your body goes through your lymphatics, and we can see that there are some things that can inhibit its function, so and cause inflammation. Your lymphatic system and your microbiome are fighting all the time. You want to have good bacteria in your gut. If you don't, the lymphatic system is going to increase your inflammatory state. And with increased inflammatory state, you're going to have decreased lymphangiotropy.
Okay. And I am one of those who wakes up several times in the middle of the night and have been told, stop taking ZQuil because long-term impacts are not great, especially for older people.
Well, you're right. There's a difference between being unconscious and sleep. So you're choosing unconsciousness. And histamine is one of those things that increases lymphatic function, and you're taking an antihistamine.
Wow. Okay.
You better watch your brain.
Yes. So I have cut it out. I've cut it out, but I'm now trying to investigate new ways to get better sleep. We have some brilliant questions that I want to pose of you from our attendees tonight. Jeanette, I believe it's Cariad, and I hope I pronounced your name correctly, asks to clarify, what was the third fundamental principle that you shared?
The third is the cell is the fundamental unit.
Gotcha.
So the cell is the fundamental unit of biology.
Excellent. Joanne Rogers, thank you for asking this question, Joanne. Could pulsed electromagnetic therapy help lymphatic function?
You know, everything has I would say, electromagnetic tune to it. You just don't know what the right frequency is that could stimulate it. So I think that it certainly could. But what is the frequency? What is the amplitude? When in development, the neurotube is the first thing that gets developed. And every time a cell differentiates, it takes a fiber from that neurotube, essentially an innervation with it. And so the flavor of the electricity is, I think, can help differentiate the tissues. So if you have a myocardial infarction and you have Q waves across the precordium, you no longer have innervation of the heart, and it can't be regenerated. But if you could supply an artificial nerve, perhaps maybe you could regenerate it. And that's kind of the same way with regenerative therapies now. You have to have the nervous system is the bricklayers, and you have to have progenitor cells which are the bricks. But if you don't have the bricklayers, you won't get the regeneration. And that's what we're seeing in our heart issues. We see regeneration around an infarct, but never a complete regeneration because the nerve is gone.
So a follow-up question similar about helping with lymphatic movement. Kimberly McDowell is a physical therapist who does lymphatic drainage, and she wanted to know about, well, she's used vibration and other tools to help with lymphatic movement. If you have any other techniques or tools that you think would help.
I sure would like to see Natricor tried. Maybe so. Natricor has such strong lymphatic function. So you got two issues. One, are the lymphatics actually there, or have they been destroyed? So if they've been destroyed, you got to regenerate them. But if they're there and they're just lazy, or they're overtaxed because you got high venous pressure, producing it, then perhaps you can increase the function. And mechanical stimulation is one of those things. If you can decongest the lymphangion, I'm sure it will work better. How we do that is, that needs to be a work in progress, because if you can do it in the limbs, maybe you can use a similar technique in the organs.
So that's a great point as well. We have people that are regular attendees of our webinars, and they have seen some other really smart people presenting information. Alicia De Silva wanted to know, have you connected with doctors Fife and Sevick, who have done a lot of work about how the lymphatics can be effectively seen and using imaging and
I've read some of their work, and it's fascinating if you can't see something, and that's one reason lymphatics have not been studied. They're hard to see. The researchers at A&M have these fancy microscopes set up with video players, and they got to dissect out the mesentery of the animal to find the lymphatics. It's a whole work. Got to keep the animal comfortable. And then after you have a steady state, then you can do different stimulations to it. When even the lymphatic network of the heart is not very well delineated, because it's really just hard. And it's been limited to some people who've gone to surgery and they put any ink in the heart and watch it while they're doing the surgery. Imaging always helps everything. But I don't know and I think skin imaging is very fruitful, and people are doing it now. But how can you image the lymphatics, in a deep tissue? Well, you can use MRI and see edema, and at least assume that if there's edema, the lymphatics aren't working, but you don't really see the lymphatics. You can't really see them.
So lots of great questions and comments. Dr. Janet Massey says, it's not a question, but the lymphatics do get tired and need time to recoup. So I think that goes along with some of the things that you already mentioned, Dr.
Yeah, say hi to Janet for me.
Hi, Janet. We're glad that you're here. We have questions about the healthy gut. Ellen Passmore wants to know, how do you feel about probiotics to help with a healthy gut?
Well, I just don't know which ones they should be. It's a big industry, and but it's likely individually related, and it depends on the type of food that you pick up, and what are the healthy probiotics. I'm afraid that I believe that there is, but I have no idea which ones they should be.
Okay. What about foods? What foods are not good for, and I love the way Marianne Howard put it this way, our little lymph pump cells? What foods are not good for our little lymph pump cells?
Well, so I would say a low inflammatory diet, and that's really kind of hard to stretch out. Well, what is it? Well, certainly vegetables, fiber, turmeric is a spice that lowers the C-reactive protein. And our dietary studies looking at low inflammatory state based on food consumption, I think is really quite limited. We barely understand salt and calories from the DASH diet in cardiovascular disease. And so now to try to pick a diet that actually alters your immune system is a big leap and requires a lot of careful study. And frankly, the people that are done going to have to be tied to the bed or room and never be able to get any other food in order to make those determinations.
Mm. You know, I personally have a question because one of your first slides talked about what increases and decreases inflammation. And I was surprised, and I'm not a clinician, so probably why I was surprised, but it said that alcohol decreases inflammation.
Mm-hmm. Yeah.
Am I the only one surprised by that?
Well, that's one reason I think athletes get hooked on alcohol. You do a hard workout and you got all this inflammatory muscles, you drink alcohol and it decreases it. So, so that alcohol in a low amount, 2 drinks a day is actually kind of cardioprotective. We don't prescribe it because oftentimes people don't stay with just 2 drinks. They will drink excessively. And so then when you get up higher alcohol intake, then it has a detriment to you.
Okay, my jaw is dropping open because there has been so much talk in recent months and even in the past year about how even moderate alcohol is so bad for you.
Well, actually, I'm not aware of those. There is a U-shaped curve. So
Okay.
if you drink too much, it is harmful to you. But a little bit is beneficial.
Okay.
But again, we don't prescribe it because it can be addictive.
Yes, we are not prescribing anybody to go to happy hour after tonight's webinar either. That's
Exactly.
not our intention here. A couple more questions, and you've been so generous and gracious with your time, Dr. Houck. Alicia De Silva, she had mentioned previously the work of Dr. Sevick and Dr. Fife. One of the things she's asking about is studying the breath. What about the breath and heart coherence?
I think I have to pass on that one.
Yeah.
The breath is if you look for the metabolic debris of the body, the breath is certainly one place it comes out. And in your gastrointestinal tract, you make gases, they get dissolved, they circulate, and it comes out your breath. But I don't have any knowledge about that.
And Marianne Howard wants to know, does wearing compression garments help our lymphatic system?
Oh, I in terms of lymphangiotropy, probably not, but they certainly, I think, help if you could get them on. It feels good, and it helps keep the skin from breaking down. But whether they actually increase lymphangiotropy, I don't know. I kind of doubt it.
Well, because it's passive compression, a compression garment,
compression.
right? But the
Right.
active compression of, say, a Lympha press.
Yes. So active compression definitely, I think will help because it's why walking helps, because your muscles are going to compress the lymphatics with every step. And then if you can't walk, the Lympha press is going to help with that.
Yeah, I thank you for saying that. So lots of great questions, lots of wonderful comments. I want to encourage everyone who is live with us tonight to please stay connected with us because we're always providing groundbreaking content here at Lympha Press. Every month, the Research Roundtable, our next roundtable is in June. That's going to focus on lipedema. It's Lipedema Awareness Month. And if you click the link I just put in chat, you can register for all of them. And then we have monthly roundtables for the patient communities, both lymphedema and lipedema. We encourage you to send those links to your patients, or if you are a patient, we'd love for you to connect. That helps with the mental health component as well, knowing that you're not alone and being able to link arms and share thoughts and ideas with other people that are successfully managing their conditions. You say in your last slide here, go to work, solve problems from a different perspective. We do have a couple more questions that have come in, but I want to give you the floor to give some final words to our audience. From your perspective, Dr. Houck, what would you like to encourage people, and what thoughts would you like to leave us with tonight?
Well, I presented a lot of information. I wouldn't assume that it's all correct. And I always tell my fellows that I'm going to tell you things, but it's up to you to go out there and figure out if it's really correct or not. But I think that like, for example, the neurotransmitter theory for brain diseases, depression, it's been in effect for 35, 40 years. And maybe it's time to take a different tact. Unless you try different things, you're never going to get out of that rut. And so be bold, do things, plan to make mistakes, because you're going to learn from your mistakes, and at least you learn that that particular thing that you didn't work. So don't believe your teachers, learn things for yourself.
Before we went live, I asked, are you a curmudgeon? And you said, absolutely.
Yes, I am.
And
proud of it.
And proud of it. Well, I mean, from your opening slide that you don't like cardiologists or endocrinologists, and you don't like nephrologists, and, all of these different things. But to your last point, I went for a walk today, and there was a little boy on a scooter having a blast, and then splat. I mean, completely wiped out. And of course, I sort of wanted to help him, and I was thinking, oh, is he going to burst into tears? And the child cracked up, got up again, and got right back on the scooter. And I thought, what a beautiful visual for me and for all of us, to not be afraid to fail, to get right back on and to keep going. And in doing so, we continue to learn and grow and develop resiliency and new gifts. So I thank you for sharing that, Dr. Houck. I appreciate every person who joined us for this live presentation tonight, and the many who will see it on the recorded webinar. We hope that you'll join us again for another Lympha Press educational webinar or one of our roundtables. And with that, have a great night, everyone. Thank you, Dr. Houck.
You're quite welcome.
Thank you.
Thank everybody.
Bye-bye, everybody.